First of all, I want to thank you for inviting us to do our presentation and share with you some of the things that we're doing in regard to interprofessional education at North Carolina Central University in Durham, North Carolina, and this is in the United States. Our topic is interprofessional education and our approach for managing care for individuals with Alzheimer's and other dementias. My name is Dr. Karen Webb, and I am an assistant professor in the Department of Nursing.
And good morning on our end, afternoon, evening, whenever you are viewing this. My name is Dr. Lorraine Graves, and I am an associate professor in the Department of Social Work at North Carolina Central University. And so we want to begin by just providing an overview of NCCU, which we will refer to, which is North Carolina Central University. And as Dr. Webb mentioned, we are located in the United States at Durham, North Carolina. We are a historical Black university, and we serve primarily African-American students, and our goal and a mission, and we were founded based on providing access to higher education to a diverse student body. One of the awesome things about NCCU is our commitment to health disparities, and our project, our IPE project, is founded under that same principle to address health disparities by bringing multiple disciplines together so that we can promote better health outcomes and increase our students' knowledge, skills, and attitudes about interdisciplinary, interprofessional approaches to addressing health disparities.
This project really stemmed from a community partnership between the Alzheimer's Association and our university. So Dr. Graves and I were introduced to this project probably 2 years ago. And in the beginning, really what our group was trying to do, and that's Dr. Graves and myself, along with some members of the Alzheimer's community and some individuals that actually either are dealing with someone with Alzheimer's or have Alzheimer's themselves. So in the beginning, we were really trying to come up with ways to engage students in the community. More specifically, what they wanted to do, the Alzheimer's Association, was for us to get students to get into the community and educate people of the disease and help inform people about the resources. And I want to back up a minute and say that the reason that this is so important is especially in the Black and Latino community here in the United States, there's a stigma with the disease. So those are the folks that really don't get help when they need it. So we wanted to get people in either vulnerable communities or people who really weren't reaching out for resources because of stigma. So this idea led us to 3 projects where we utilize students from different departments, health profession departments, to help promote Alzheimer's. I mean, we did this through 3 different activities. We did a participation in the Alzheimer's Walk. We just did our second one a couple weeks ago. And we also did these roundtable events where Dr. Gray will talk to you about, and then we did a community health fair.
And so the departments that came together was the Department of Nursing, the Department of Social Work, the Department of Kinesiology, the Department of Public Health Education, the Department of Nutrition and Dietetics, the Department of Community Science and Disorders, Communication Science and Disorders, the Department of Psychology, and the Department of Counseling Education. We had 1 faculty representative and students that participated in the different events that Dr. Webb just mentioned. So I'm going to go through one of our projects that we did with our interprofessional team. It was broken down into 3 phases. And so what we did was provide, as Dr. Webb talked about around Alzheimer's, we wanted to bring the disciplines together to really learn about Alzheimer's disease, in addition to how they would approach working with an individual that is diagnosed with Alzheimer's and their family. And so we began in phase one, where Alzheimer's Association, which is a national, as Dr. Webb mentioned, a national organization in the United States that really works to advocate and address health needs for this particular population. And so they designed an online module for our students, and our students took three online courses that were a long 1 hour long, and so they were introduced to the disease through these educational modules, which helped them as they continued on in the project. The second phase of the project was a evidence-based team steps training that was delivered by a master trainer. And it was a 2-hour in-person training where the disciplines came together to learn strategies and tools, how to improve communication, teamwork, as it relates to caring for patients with Alzheimer's. The last phase was the actual roundtable. And so this is where they're using the education they learned from the self-paced modules, the team steps training that they learned how to work together. This is now, they're applying it in a simulated event where they have a Alzheimer's case in which they talk about it. We had multiple groups with different disciplines represented, small groups where they talk about how would they approach assisting and addressing the needs of this Alzheimer's case based on your disciplines. And so this allowed them to come together and talk about and put together a plan, an interprofessional plan on how they would address the needs of this particular case.
So our next event was our community health fair. This definitely provided another opportunity for health professional students to work together to benefit our community. I want to say that was our very first community health fair that we put on at North Carolina Central University. This was a student-led event where one student from each department led their department. So let me explain a little bit. So what that student, we called them an ambassador. We brought them on, and these students worked together, again, from each of those disciplines that we talked about. And they came up with ideas of how to recruit students from their department. So they were charged with this. And they were also charged with reaching out to vendors. So when I talk about vendors, I mean people that would come in, and like the Alzheimer's Association would be a vendor. Blue Cross is another one. And we had the public health department come in. So each student was charged to reach out to different vendors from their discipline. I think we had over 50 vendors come and join us for this community event. We also had about 60 students from various disciplines also who came and volunteered. So during the health fair, what the student volunteers from each health professional program did is they collaborated, they did it on their own, and they came up with different educations that are common health issues in our community, including things like diabetes and hypertension. And then they educated the community on those specific diseases. And again, this IP Community Health Fair at our institution served not only to provide the community health services, but also resources. Our students did things like they took blood pressure, they took blood sugar. So it was a really, really fun event. And I don't know if you wanted to add to that, Dr. Graves. So many lessons learned, but this is a few of them. So one of the things that we learned is that we definitely need support from administrators from all our departments. Our second thing we learned, Dr. Graves,
was the need. We learned in terms of coordinating, as you saw, we had 8 disciplines together. And so coordinating the disciplines is something that takes time, and that's something that really needs to be considered in terms of course schedules, accreditation requirements, internship requirements. There were so many different aspects of the different disciplines that needed to be considered or needs to be considered when doing IPE. And so what we learned is that we really need to ensure that each discipline is meeting their requirements for their department, and as well being able to come up with ideas that will support the disciplines, but also help bring disciplines together so that we can have more projects, more initiatives, in addition to getting out into the community. Because that's one of the things the goal of our IPE is that, you know, we have a space for disciplines to come together that will eventually go out into the community and serve the community together. And so we're looking at, you know, continuing that discussion around how do we coordinate given the different expectations and requirements of our programs to make sure that we're still honoring that while being able to push the mission of serving the community.
So this was really a pilot for us, all three initial events. So what we learned is we really need to make sure we develop effective IPE and be inclusive of all disciplines. I guess a perfect example that we want to share with you is in regard to team steps. So team steps, as Dr. Graves talked about, was a workshop that we did that we brought all these disciplines together to teach them effective communication, which was great, and team steps is wonderful, but the person who taught it really was geared towards nursing. So next time we know that when we do any kind of program that we will need to be inclusive of all disciplines, and make sure that it's effective for all of them.
Yeah, because there was certain language that was being used that wasn't transferable across disciplines, which made it difficult for some of the disciplines to grasp and to apply. And so again, I think that coordination, that discussion, more discussion needs to happen among the disciplines to be sure that we're meeting the needs of the disciplines in addition to being able to serve the community. And then our last lesson was around funding. We, again, in order to really move the IPE further, it really took a lot of time and effort from the faculty and the students, as Dr. Webb mentioned about the ambassadors. It takes a lot of time from the students' already busy schedule, in addition to the faculty schedule. And so really needing some support that can fund faculty and students' time, in addition to moving towards developing courses so that students can gain credit from engaging in IPE initiatives or courses. That's really the direction that we're looking to move in, because we really saw the benefit of bringing disciplines together in this project and then being able to converse with each other around health disparity areas. And it was just so amazing, and they were amazed and excited to have these discussions and learn about the different disciplines, because as we started off the presentation, oftentimes we're trying to address these disparities and silos, and so we're really trying to make this a shift the way in which we address health disparities by making sure that we have different disciplines at the table to address different health needs. And so this was a great start for us, and we want to keep it going. And again, I think these lessons that we're learning from this initial pilot is helping us to be able to have discussions with administrators, have discussion to be able to keep this going and to make this a part of the culture here at NCCU.
Thank you so much.
Thank you. And if you have any questions, please feel free to reach out to Dr. Webb and myself. We'll be more than happy to answer any questions and to talk through any of the areas that we covered today.